loss of my grandmother, loss of my mom, because both died while I was not there. And I was just told the symptoms that they had, and I was trying to figure out why. Okay, is it going to happen to me, my brothers and sisters, stuff like that? So it pushes me to go and learn something. In fact, when I was little, I wanted to be a doctor because I love the white jacket. When I was little, like when you're kids, you're thinking, okay, I want to do this. People want to be police officers because of the uniform. Yeah. So when I started working with when I missed out from my grandmother, I missed out from my mom, taking care of that person, I wanted actually to be right there with the patient. So that's the part which pushes me to be a nurse. And so I found that route. So of course, when I came to this country, a lot of opportunities, I was able to do a lot of stuff with nursing. So yes, I was doing in the hospitals. I did start from the nursing home because I wanted to help the elders eating, feeding, and stuff like that. So that helps me to be able to be on different levels as a nurse. And then be a bedside, and then I'll be a charge nurse who is in charge of the unit. Then I'll be a preceptor, teaching preceptors to try and make sure that everybody knows what they're doing as nurses. So with that understanding, anybody wants to be a nurse? Maybe? She's thinking. I know you have a question.
Shock delivered.
So if this helped the baby, then the baby just gonna jump up. If not, then they say we begin CPR. You know how to do CPR? Yes, go ahead. Go ahead. Put your 3 fingers. But for adults, you do this.
Chad.
So 30. Give 2 breaths. 2 breaths.
But at home, they don't have the breast.
Yeah.
Keep going. Keep going. So if you're pushing for it, then you can see them. Okay, so that is for the little baby. The same thing for adults. You're gonna do 30, and then they give 2 breaths. 30, and then 2 breaths. But at the hospital, that's what they use. You wanna try? Okay, put it.
So how many compressions? How many compressions, guys? No, how many
How many
compressions?
compressions I was counting?
What you was doing?
30.
30. There you go.
So usually
Good
it's
job.
30 and then 2. So if this is your brother, sister, mom, and you are Because the idea is you're squeezing the whatever is in the heart out and then bring it out. And then somebody can, okay? Two fingers, yeah. It has too much. There you go. That means you have the right weight.
Can I try? Yes, you got to keep going.
Can you see that?
You're alive. You got a pulse.
Oh, yeah.
Yeah, I can hear it.
Yeah.
You should be able to feel it.
It's the bell, but together with me.
Okay. That's one for you. Thank you for
Mommy, come here.
Huh?
Because I want to help my mom with this.
Oh, you want to for your mom? Okay. Very good. Oh, that's just keeping like this.
And you got one more hand back there.
Okay. You know what it is? So you can say
Girl,
that.
just put it in. You can put it in now. Like this. Oh, yeah. Oh,
Yes,
you
now
put
you
that
have.
in
So
here.
please go and show your hands that you have something. Okay.
And you got one more. Over.
Yes.
Because if one of my family members, there's something wrong with them, I could always help them, and I know what's wrong, and I know what steps to do to save them.
Very good.
And then you got one more over back there.
Kimberly?
What?
Because I want to help people, whoever gets sick or whoever gets injured.
You think everybody can be a nurse?
Yes, it takes like a mind to do it.
Nah.
That's what I wanted
That's
to
what I
hear.
thought.
Yes.
And I know that you have.
I'm not sure why. Exactly. So yes, that's a practical teaching. Yes, you go and find out what is going on with the patient, what their concern or complaints, and then what to do. So when you're doing that part, you are learning what is troubling them, so you can help them. So usually, majority of the time, once the doctor gives that diagnosis, this is what the patient has. So then the nurse take that diagnosis and go and educate the patient exactly what the expectation is, and then help them to go. Bring the hospital and then go home. So then when they go home, they can take care of themselves. You don't want them to be admitted at the hospital. Okay, so one of the things that I'm hoping you get out of it is nurses also save lives. With all the other healthcare, but I'm just focusing on nursing as a nurse. Our goal is to save the life, no matter what the patient is going through. Learning how to resuscitate the person and huh? No. What do you say? Yes, exactly. Because remember, if you push again, means you're pushing on both of the heart and you just sit there. You push in the middle because you're trying to force the blood through it, right? So that's how you're pushing it there, and that's how you push in the middle. And you have to be harder and push almost 2 down to make sure you decompress the That's 2 minutes. It's not easy, and that's why you have to change. Switch with somebody else because you don't want to keep doing this for 10 minutes and then you're gonna get yes. That's exactly you can see that if you go slowly, it's not helping. If you go too fast.
There we go.
Okay, that's good. But anyway, so as a nurse, I said one of the roles is just to save people because we do have a non-profit organization where we train and educate nurses and doctors and train outside. So I do also in the community teaching, educating nurses outside, educating patients outside, and then of course doing research to try and make things better. So the reason I chose nursing for me, I like helping people. So anybody likes to help people?
Yeah.
Yes. So can you be a nurse then?
You could be something else and help people.
Yes, exactly. That's what I was getting for. Yes. So as a nurse, I mean, I like to help people. Yes. You can be a nurse and helping people, and you can be something else that's helping people in a different ways. So, but that's all. The nurse don't work by themselves. We also depend on the whole community to do stuff. So yes, you choose to be a nurse, sure. But if you don't choose to be a nurse, you can do something else after that. I chose to be a nurse because my grandmother was sick. I was like 8 years old that time. I didn't know. And then so when she was sick, because I enjoyed going home and see her, and she always give us stories and jokes and stuff like that. So with that, when you start getting sick, yes, you can find something that you is gonna make sure you do what you need to do. But anyway, so learning from that, my mom also passed away because she has hypertension. But the problem is I did not know then what I know now. So if I knew, maybe we would have been years of talking to her and know. Doctor side and the nursing side. So let's say doctor side. You can be a lawyer and you can be a medical doctor or BGYN. And those things can work together because the labor and delivery or the delivery specialty is I mean, it's always scrutinized because nobody goes to the hospital when something goes wrong with the baby. We all want the healthy baby, a healthy mom coming out, right? So that area is like, you have to be the best of the best to make sure that the mom and the baby is okay. So if you're an OBGYN, then you're gonna see the ladies before they have a baby, until they have a baby, and then of course usually they go and see the delivery. So you don't wanna see the delivery, but you just wanna bring them to you and then leave somebody else to deliver. Why? Because that's the best part. I mean, I love even that part when I see a new life coming out. And then bring it, give it to mom.
Why don't we hear all that?
No, that's okay. Nowadays there's the epidural. There's a lot of stuff we can do for the mom to help them so they don't scream at you. And then also you get a good labor and pregnancy. We coach the mom so mom doesn't, or you get the doula who will help mom to understand the process. But I mean, that's good. And also for the lawyer part is, you can be a consultant on the medical part. You have your lawyer degree, the law degree, and then you can be that. So all those things work. The same thing we have the nursing consultants. They are lawyer by trade, still nurses, so you can understand the charting, the patients and stuff like that. So you can still do both of them. So that's very good. Just keep up. What about you? What do you like to do? You grew up and there's something happened to your family, and then you feel like, okay, you are compelled to do it, or something happens to you and maybe it was not the way it's supposed to be, and people want to go and do it right, and then they have a family member or something that they want to do, or some people just want to the uniform. Some people say, oh, I like the uniform. Yeah, you have to like nurses more than that. But it's, when we're with the patients at the bedside, or we're in the community, and ask for help so you can be helped. So one of them is like if you have a little infant, which is a baby less than a year, and then also I want to get two at a time. So you two come.
That's good.
Okay. Do you have a young sister or brother? How old? 7 years old. Okay. So we're gonna pretend this is the little baby, 7 months. Okay. His name is John. Okay. So you're babysitting at home. So you're babysitting at home, right? And then you fed him an hour ago, 2 hours ago, and he's sleeping. But now you're supposed to go and get him ready for wherever mom is coming or dad is coming. So go ahead and wake him up. That's how you're gonna wake him up, no? What do you do? What should she do? What should she do? Right.